The iStent Videocassette Pedagogy, an innovative teaching guide for MIGS platform. The G1 series. The glide, the ideal implantation technique. Before implantation, it is imperative to identify the angle structures. Here we are implanting the G1 iStent into the trabecular meshwork with the proper gliding technique to ensure the proper placement within the angle. Following which, we can release the trocar and assess the stable placement of the iStent within the trabecular meshwork. And a functioning trabecular outflow system can be seen by the blood flow within the collector channel from the position of the iStent. The cheese wire, the management of trabecular meshwork cheese wiring. Every trabecular meshwork has a different consistency. Here we have a case of a very friable trabecular meshwork which cheese wires on the multiple attempts for implantation as seen here. With every reattempt, the trabecular meshwork gives away. So we had to change our maneuver into a more firm and forced glide into the trabecular meshwork for a proper implantation and a stable placement of the iStent. The nudge, confirming the position of the iStent implant. Here we have another case of the G1 iStent which is being implanted into the angle with a proper gliding technique. Following which, we are not able to identify the positioning of the iStent within the trabecular meshwork as shown here. In such cases, with slow and controlled maneuvers with the dialer as shown here, the iris can be nudged gently to identify the scleral spur and identify the position of the iStent within the trabecular meshwork. The rebound, tackling the iStent rebound due to trocar malfunction. In this case, following the successful gliding implantation of the iStent into the trabecular meshwork, due to the trocar malfunction, the iStent rebounds during the opening of the claws of the trocar. So, to properly reattempt an implantation, the iStent was retrieved using the trocar. And keeping in mind the trocar malfunctioning, the iStent needs to be released in a proper and controlled fashion as shown here. Once inserted, the claws needs to be opened completely before retrieving the trocar. Following which, the iStent can be gently tapped to ensure its stable positioning. G1 implant plus Cahook dual blade goniotomy, the combined MIGS. Here we have a case of an G1 iStent implantation which was successfully implanted into the trabecular meshwork. Following which, an additional MIGS procedure was performed, the Cahook dual blade goniotomy, on either side of the implantation at least 1 to 2 clock hours apart to increase the outflow via the trabecular meshwork. The G1 implant plus bang, combined MIGS. Similarly, in this case, with the implantation of a G1 iStent, an additional MIGS procedure was done. Here we did a bent ab interno-needle goniectomy on either side of the implant at least 1 clock hour apart to ensure an additional outflow via the trabecular meshwork. The G2 series. Dimpling and blanching. For proper placement of the G2 iStent, we need a proper dimple at the angle depicting good firmness to ensure that the iStent is well placed within the trabecular meshwork. and additionally a second iStent is placed in the similar manner at least 1 to 2 clock hours apart. Here we can see the two iStents adjacent to each other via the limbus. And additionally, we can see an area of paralimbal blanching which depicts a successful outflow. Lost but found. Correct method for retrieval of dislodged iStent. In this case, due to improper dimpling technique, that iStent was implanted superficially, and hence the iStent was dislodged. Continuing the procedure, a second iStent was implanted with the proper dimpling technique. Following the implantation, an iStent retrieval was done by rethreading the iStent via the trocar. But as the sleeve of the trocar was not completely closed when removing it out of the wound, the iStent was lost. As we can see here, it is an empty trocar without the iStent. The iStent was found within the corneal wound. And again a reattempt at retrieval was done by a rethreading of the iStent into the trocar. And this time there was complete closure of the trocar by the sleeve before removing it out of the eye. And here we can see a rethreaded iStent in the trocar. Following which, the second implantation of the iStent was done with proper dimpling technique, ensuring that the iStent was well placed within the trabecular meshwork. Here the data shows adequate reduction of intraocular pressure post-operatively. Practicing in the ophthalmic metaverse, the novel 3D simulator. With the use of hand tracking in the HoloLens, a simulated training module can be created. The 3D eyeball model gives a real-time simulation of the angle structures to practice the implantation of the iStent. During the simulated training on proper implantation of the iStent in the trabecular meshwork, the indicator lights up as green. And this training improves the agility of the doctor for implantation of the iStent in the angle. Thank you.